As the healthcare environment continues to evolve and the complexity of the hospitalized patient grows, the challenge to continuously improve outcomes is daunting. Creating an environment that meets the Institute of Medicine aims for quality, safe, timely, effective, efficient, equitable, and patient-centered care is every organization's challenge.
The University of Alabama at Birmingham Hospital is an 1,157-bed public academic teaching hospital where the nursing staff is a critical success factor for excellence in care delivery. Like other organizations across the country, UAB is held to a high standard when assessing quality outcomes. In 2016, in collaboration with the Patient Safety Committee, nursing requested an in-depth analysis of pressure ulcer reporting in order to assess variations in processes and outcomes reported. The purpose of the study was to evaluate the use of the clinical nurse leader for examining and evaluating pressure ulcer reporting. With pressure ulcer being an adverse event that may lead to poor patient outcomes, increased length of stay, and higher cost, it is imperative to understand the workflow surrounding patient assessment and preventative processes, as well as to understand how data are reported to ensure accuracy in measurement.
In May through July of 2016, a small test of change 90-day pilot was implemented in 2 patient care units, an intensive care unit and a medical surgical unit. Using the Model for Improvement and the Plan, Do, Steady, Act process, the improvement team sought to answer the following questions. What are we trying to accomplish? Ultimately, our goal was to understand pressure ulcer reporting, identify opportunities to improve our reporting, and to compare the clinical nurse leader or CNL documentation of all stages of pressure ulcers with that of the staff nurse. How will we know a change is an improvement? Change was evaluated comparing baseline counts of hospital and community-acquired pressure ulcers from an existing organizational report to counts obtained from a database used by the CNLs specifically developed for the pilot. So what changes can we implement that will result in improvement? Every day, each CNL evaluated every patient on the 2 pilot units for evidence-informed practice bundle implementation and counts of pressure ulcers. Using data from June and July of 2016, as May was considered a training and validation month, variation was reported in the counts of both hospital-acquired and community-acquired pressure ulcers when comparing the staff nurse documentation of pressure ulcers with that of the CNLs. As highlighted in the table shown, the variation in the documented pressure ulcer counts varied monthly, from 21 to 50% for hospital-acquired pressure ulcers and from 10 to 35% for community-acquired pressure ulcers. In addition, when evaluating the evidence-informed practice bundle implementation for each patient, 67% of the patients in these units received all elements of the bundle.
At the close of this pilot, although there were limitations such as the short duration of the pilot and the inability to validate sustainability, the project team found that the early results supported the effectiveness of the CNL role in identifying opportunities in pressure ulcer reporting in this organization. Furthermore, the information uncovered during the pilot has led to opportunities to improve pressure ulcer data capture and reporting, validation of and opportunities to improve evidence-informed practice bundles, the importance of a unit-based skin champion, and the importance of a dedicated role for microsystem improvement. In conclusion, reporting pressure ulcer data accurately is complex and requires focused attention at the front line of care. Following this pilot, we have found that the CNL role had a direct impact on improving pressure ulcer reporting within the organization. The pilot also supported the organizational view that the CNL role has had a direct impact on microsystem improvement. If you're interested in more details on this project, the full article is available through the Journal of Nursing Care Quality.